Hello dear friends and colleagues. Today we are very happy to introduce to you Omega Ring, a very nice, soft, silky, smooth pupil expander. Wishing you a very happy Republic Day and a very progressive and prosperous new year ahead. We dedicate this video to Dr. Akura Junsuke of Japan and Srinivasan of USA and India, both of whom are key persons in development of Omega Ring for the Indian Ophthalmology Fraternity. Our acknowledgements with gratitudes to all these colleagues for their suggestions and contributions. With increasing diabetic population and increasing life expectancy in India, as well as increasing prostatism, nowadays we get small pupil cataracts much more often. If we don't use any pupil expander, often we end up in complications such as these or like these. So we have recently innovated Omega Ring. Many times a diabetic pupil is treacherous. It will dilate fairly okay initially, but it starts to constrict during the surgery, partly by washout effect of dilator drugs, BSS turbulence, ultrasonic vibrations, and more bright microscopic light falling on the retina. Stretch pupilloplasty is not a very elegant nor a very efficient way to dilate such tight glycogenized pupils. Sometimes the stretch pupilloplasty can lead to a non-dynamic, permanently dilated or mid-dilated pupil, often with iris tucking. Any over-trauma to the iris sphincter has a chance to give rise to CME, especially in diabetic eyes. Imagine and understand the stretch pupilloplasty as iatrogenic traumatic mydriasis creation. Please refrain and stay away from it. Iris retractor hooks are basic and least expensive pupil expanders, but they need 4 to 5 extra paracentesis, which increases chances of leak and risk of infection, especially in these diabetic eyes. Also, they cause iris to tend forward and causes temporary iris bomby due to retroiris visco and BSS buildup. Iris tenting forward also causes some loss of anterior chamber stereopsis for the surgeon. And we often get iris entanglement by phaco or IA handpiece or even the IOL while injecting it or its cartridge tip, which can cause iris transillumination defects or a root dialysis, maybe with hyphema. Major portions of hooks are external, so many times they get entangled in drapes, speculum and keeps rubbing with the eyelashes. Most often, iris hooks leave scratch marks on iris surface and may leave crooked pupil margins. These iris scratches are analogous to tree trunk claw marks of wild savage animals. Having used in over 1,000 eyes by now, in our opinion, Omega Ring is the most elegant way for temporary and optimal pupil expansion, not just for cataract surgeons but also for vitreoretinal surgeons. Omega Ring looks like this in front view and like this in the side profile. These are the approximate dimensions of Omega Ring. First, we keep the ring on cornea in such a way that these 4 dialing holes are facing frontward, anteriorly or skywards. This soft, silky, smooth and feather-light ring can be inserted just with Lester hook and can be engaged into the pupil just with the Sinskey hook. Change of hands and engaging the 2 remaining pillars with the Sinskey hook and then bringing the pupil into the center of the cornea. Alternatively, we can use Osher Y hook or Kuglen hook. No other special injectors or dedicated instruments are needed, and minimum incision size is 1.8 mm. Even we can insert Omega Ring just by the McPherson forceps. No other instrument is needed at all. Engaging the ring is also very easy, just by the Sinskey hook. No other instrument needed. It can be done single-handedly without any globe stabilization. The ring remains in front of iris and is clearly visible throughout the surgery. This ring gives nice 6 by 6 mm square pupil, well centered. So we get a nice 4 sides as guidelines to do 5.75 mm diameter round capsular axis, which also is well centered. After IOL implantation and before visco wash, disengagement of the ring is also very easy, just by the Sinskey hook. Ring removal is also very easy, just by the McPherson forceps. Please notice that the pupil shape is back to normal exactly as it was at the start. This ring will not budge no matter how much it is nudged, accidentally or intentionally. Even if we push thick visco cannula underneath it and nudge or try to move or disengage, it will not budge or disengage. Even if we intentionally try to displace or disengage the ring by phaco sleeve or tip, it will not move. It stands firm and still like black cat commandos of PM or President of India. The ring is so nicely malleable and so resilient that it remains stable and steadfast even when rammed, thrusted or jolted. We can even do whole phaco procedure from underneath the ring. Even with a slightly torn phaco sleeve, the ring will not get dislodged. Of course, this stunt is just for the demo of stability. Please don't do it. Even if we do entire bimanual IA from underneath the ring, it will still remain so stable. You can try this. Here, during the IOL implantation, I am deliberately trying to dislodge the ring with the cartridge tip, quite forcefully and jerkily also, but the ring stays firm like an Indian Army soldier standing on attention. This is our Autofocus Pro, a big 6.3 by 7.5 IOL with serrated haptics, and as we can see, the ring is so loyal that it does not leave its job position in spite of IOL haptic first trying to kick it and then trying to drag it. Many a times pupil is fairly okay dilated when we start the surgery, but pupil starts to constrict during the surgery. This ring can be implanted at any stage of the surgery. In the aphakic stage, we just have to fill the bag with Helon GV or something like that to mimic the presence of a soft nucleus. The ring is so soft, smooth, gentle and kind that there is never any worries about the intercapsular rim getting torn or ripped off. One more case of mid-surgery ring insertion which is easy, safe, sure and secured. Even in a very small and tight pupil, we never need to do sphincter stretching. In fact, it is not advisable in general, and because this ring opens the pupil without much sphincter tears, the pupil comes down to original size and circularity as soon as the ring is disengaged. This sleek, slim and slender ring is just about 250 microns in profile, so even in a very high hyperopic eye with quite a shallow chamber, the insertion is so easy. Omega ring is also very useful to retinal surgeons when they have to do retinal surgeries in small pupils, especially in long-standing diabetics. In a large series of eyes over last 36 months, we have found no additional corneal endothelial cell loss, no iris damage or chafing, no sphincter tears or sphincter atony, no intraoperative dislodgement, no iritis nor TAS, and no CME in any of our patients. This ring is made in 2 sizes. It is so easygoing that practically there is no learning curve. Even phaco trainees can learn it in 1 case and master the tricks of it in 5 to 6 cases. Officially speaking, this is a single-use disposable device, but because this ring can be efficiently cleaned in ultrasonic bath in water for injection and then can be autoclaved or ETO'd many times. Both these items are made from the same reusable material so that per case cost come down almost to cost of a cup of tea. The design of this ring was divinely inspired on 15th August 2016 in a flash of a moment at the time of Antim Darshan of Param Pujya Pramukh Swami Maharaj while making the last garland for His Holiness from white 4-petal flowers, papers of which is being blessed by Param Pujya Mohan Swami Maharaj, the chief saint of BAPS Swaminarayan Sanstha. Another important source of inspiration, of course, was Dr. Elijah Kakadia's 4-petal flower clover ring. By the way, thanks to the Omega ring, I could gift her many more rings. And we are sure that you can also do the same for your sweetheart and or for your better half. Omega rings are now available for Indian eye surgeons from Excel Optics Chennai, and we have no financial interest. We beg your pardon, but free samples are not possible, and for price and paid samples, please contact Mr. Nagaraj, the sales head of Excel Optics Chennai, and here is his contact number. There are over a dozen types of different iris expansion rings, but they all need their specific injectors or dedicated forceps, are not reusable and are quite expensive. Many a times ring is more expensive than the IOL the patient has chosen. Of all the rings we have used so far, Omega ring is simplest, cheapest and the best of the best. To conclude, all rings are gold and diamonds, but the Omega ring is like jewel of the crown studded in platinum. The name Omega denotes the pupil size which goes from mini to mega and is back to mini. And the pun fun is Omega. And there is also Om in the beginning. Well, before we end, few clicks for the day. 26 January 2026. A nice and simple photo trick. So easy to learn and master to capture setting or rising sun. And to capture smileys in a cup of coffee or black tea. Well, let us conclude with this nice quote from Rumi. Let our aging be like autumn. The leaves definitely fall, but the colors are more beautiful than ever. Mega thank you from Omega Ring for your kind attention and patient listening.